Happy Monday, everyone. Todd Thoughton here from Thoughton Physical Therapy. Excited for another episode, Facebook Live, number 60. Number 60. Can't believe it's already been 60. What a great journey this has been. Todd's tip of the day. Why? With Piriformis Syndrome, massaging or stretching your piriformis is never the answer, never the cure to this problem. Never, never, never stop it. Drives me crazy. So in this episode, you're going to learn why doing manual techniques or massage on the piriformis muscle will not lead to the cure and what some other options are that might be effective. My name is Todd Thoughton. I've been a physical therapist for just about 25 years, and I'm passionate about helping people in any way possible, specifically the physical body, but also with the mindset. Because I really believe that there's a mind-body connection that we really need to work on with every person that comes in the door. So first, we want to get used to a few different pieces of anatomy, some things that are going to be going on with the piriformis of the glute area. The hip muscle and the pelvis surround some of the most important muscles in the body. The lumbar spine, we have the sacrum, we have muscles, nerves, and discs. The muscles that are involved in this area are the gluteus maximus, the gluteus minimus, the piriformis, the famous piriformis, which is below the gluteus maximus, as well as some other small hip rotator muscles that are underneath that. The psoas, the iliacus, the adductor, and the sciatic nerve. These are all really common muscles that you hear people talking about. So we have the glute max, which is otherwise known as the butt muscle, is the most powerful muscle in the body. It attaches on the back side of the body to the coccyx, the tailbone, and the sacrum, and it also attaches to the femur. It is primarily a hip extender, which means that it kicks your leg backwards. It is also an adductor of the femur, which brings your leg towards your midline. We have the gluteus medius muscle, which also goes to the back portion of the pelvis and the ilium and attaches to the femur at just another piece, one of the bones that sticks out on the side of your hip. Its primary job is hip abduction, kicking your leg out to the side, but also to stabilize. It is not a primary mover of the hip. Then we have the gluteus minimus muscle. It is also used for hip abduction, but also hip extension. It also attaches to the posterior section of the pelvis in the glute area. Then the piriformis muscle, which its job is to externally rotate the femur, which means turn your leg outward, and also extends the hip in, when the hip is extended, I should say, externally rotates the femur when the hip is extended. Also, it abducts the hip, which brings your hip out to the side when the hip is flexed. Then we have the adductor muscles, which is the inner thigh muscles. Attaches also to a piece of the pelvis and also attaches to the femur, which brings your legs inward. Then we have the psoas muscle. We have the psoas and the iliacus, which are two separate muscles on the front side, the anterior portion of the pelvis. We have some other small rotator, the obturator and internal muscles, obturator, internus, and externus, as well as some other hip rotator muscles that are small that aren't really talked about too much. Then we have the sciatic nerve, which is the major nerve for the lower limb and the largest nerve in the body. That's the one that goes down and innervates your leg. So what is piriformis syndrome? To me, piriformis is such a small muscle, and I feel that we pay way too much attention to it. And if we worked on the mechanics from the rest of the body, there really would be no issue with the piriformis muscle. But what is piriformis syndrome? When we can have pain or tingling in the buttocks area, it can also be confused with sciatic pain, which is when we get pain referred down the leg. It's typically known to aggravate the sciatic nerve because sometimes the piriformis muscle, the sciatic nerve goes along the piriformis muscle, so you can get the nerve type symptoms. So who typically gets it? Well, runners typically get it, very active people get it, but also people with improper training methods, and anyone that does not have a good core or low back regimen. Weekend warriors, people who try to sit a lot and then try and be active. So again, weekend warriors, people that are sedentary but then trying to do some crazy awesome activity. So what are some of the symptoms of piriformis syndrome? Well, pain or numbness in the buttocks area, the lower back pain, and your hips just feel off. So what might I see when patients come in and complain of the pain in the buttocks area from an objective perspective? From my perspective, would be the patients who complain of pain in the buttocks area, also numbness in the buttocks area, and occasional numbness following the sciatic nerve path all the way down your leg, and also might experience weakness in the foot or maybe even a foot drop. So those are the symptoms that they're going to tell me. Now, what am I going to find as a physical therapist? I'm going to find that they definitely have weakness in the glute max, weakness in the lumbar extensors, weak abdominal control with function. I'm going to notice significant spasm in the glute medius muscle, locked up or not moving SI joint, torsion of the hips. They're going to make you feel like one leg is longer than the other, and significant weakness with dorsiflexion, great toe extension, which means holding up your big toe, and heel raises. And the lumbar spine motion is going to be limited. What would we might find? We might have inflammation through testing of an MRI, but it's really unlikely that someone has an MRI after just a Piriformis syndrome. So what is the typical treatment? And this is kind of one of my things that drives me absolutely crazy. The typical treatment of someone with Piriformis syndrome. Now, I will say disclosure, I like to use Graston. I've had dry needling done to me, and I think it's a great adjunct, but we cannot start here. When someone starts it, they come in with gluteal or butt pain, and you go right at that. To me, it's missing the boat completely, and that's why usually people are not getting better. Again, what's the definition of insanity? Going back and getting the same treatment over and over without noticing any improvement. Crazy things that people do is the cross-legged stretch, the figure 4 stretch. Lie on your back, cross your leg. Oh, it feels good in the moment. Someone tells you it feels good and that's the treatment that they're getting. Ask them, are you still injured? Okay. How long have you been injured? Okay. Consider maybe that it's not working. So the piriformis stretch really helps Piriformis syndrome. It's coming from a deeper cause. So please, if there's anything you hear from this, is consider this something else by doing the cross-legged stretch or the figure 4 stretch, because that is something that really works. Even though it feels good in the moment, it's not going to correct anything. Another thing is deep tissue to the piriformis muscle. Why would you aggravate something that's already irritated and hanging on for dear life? Why would you dry needle the piriformis right off the bat? It can be again, dry needling is great. I've had it done myself, but why start there? If we do everything else, we work on the core, we work on other areas first, then we can go to the dry needling, but it's not something I would start with. So what do I see as something that might be helpful for Piriformis syndrome? Well, I believe that everything is related to the spine. So even something close to the spine, like the piriformis, I always start at the spine. I'm going to say it's a lumbar spine issue or even a neck issue, believe it or not, that can be causing weakness in your lower leg. The piriformis muscle, in my mind, when it's tight and in spasm, it's because it's trying to protect your body. Something else is not working, and I can say with 100% certainty it's always the glute max muscle that's not firing correctly, and the glute medius muscle is overfiring, making the piriformis hold on for dear life. Why would you stretch a muscle that's trying to protect you? I don't get it. I still don't get it. I see it all the time. So what would I do? Number one is I would start with the lumbar spine. I'd look at the mobility of the lumbar spine. I would look at the mobility of the thoracic spine, your mid-back. The mid-back has to be mobile for the rest of the body to work, including the neck and lower back. I would assess the SI joint and the mobility issues at the SI joint. I would look at the hip mobility issues. I would look at the ability of the patient and test their core strength, their abdominal strength. Just because you do sit-ups, can hold a plank, really means you have good core strength. Doesn't mean you can certainly work through a movement pattern just because you can do a plank. I would strengthen the core muscles using the fuse box idea that we need to pay attention to everything along the spine, meaning from the neck all the way down the abdomen, as well as the low back and the muscles along the back of the spine. After we have a really good engagement program, I would do a lot of work on the glute medius muscle because we know that that's going to send refer pain down. Then we would do, after we worked on activating all the core muscles, then we're going to take a look at anything else that needs to be addressed. I'm going to look at flexibility of the hip, then I'm going to look at flexibility of the ankle. A lot of times ankle inflexibility can change symptoms of the whole body and change your gait mechanics. So work on the core, work on the glute medius muscle, then check on ankle flexibility. And that's where I would start. At that point, if someone is still having some discomfort in the piriformis, that's when I would start. I would check in with doing the Graston, some dry needling, anything else like acupuncture or even injections. So hopefully this was helpful, that in short, working Todd's tip of the day, I would suggest you address the core stability issues, the real issues of the problem, before going right at the piriformis muscle, because the piriformis muscle is rarely the issue. It's only a symptom of what's going on. If you feel this was helpful, please feel free to tag someone. Please feel free to send me an email if you have any questions about what I talked about tonight or any topics you'd like to hear in the future. Excited to be here for episode number 60. Hope you guys are all doing well and hope to see you again next week.